There are those who have risen to the challenges of inadequate maternal health care and basic amenities by extending a helping hand to rural dwellers. Ananda Marga Universal Relief Team, Amurt, is a private international voluntary organization which was founded in India in 1965. Amurt Foundation started work in the southern eastern Nigeria in 2010. In partnership with Ebonyi State Government, Amurt has developed a model for primary health care with community participation as the key of the strategy. The main goal is to reduce maternal and newborn mortality. In 6 years, Amurt has opened 7 rural health centers in 3 local governments. Amurt identifies remote rural communities that have no access to health care. Those communities with the leadership and determination to carry the responsibility for the construction labor, skilled and unskilled, will be selected. The communities decide the location of the new health center and contribute sand and gravel. Amurt provides the remaining construction materials, furniture, medical equipment, and startup inventory of drugs and supplies. The community forms a clinical management committee to run the affairs of the health center. Amurt trains them in the management of the drug revolving fund to ensure that drugs are always in stock and to enable them to save funds for operating expenses and maintenance of the health center. Government employs core health workers. The new health center is owned by the communities. As they have invested themselves in the health center, they feel the responsibility to maintain it. The high maternal and newborn mortality rates in rural Nigeria is due to that most deliveries are at home. The poor access and low confidence in the health center keeps the mothers away. Too often there are no staffs on night duty and weekends. To reduce maternal and newborn mortality, 24 hours access to health services every day of the year is essential. In the Amurt assisted facilities, there are comfortable staff quarters, motorized boreholes, and generators to make easier for the health workers to be at their station. Amurt works with the communities to recruit sufficient additional local staff to ensure the minimum standard. The average number of staff is 15. We also take trainees, bright young men and women who seek the opportunity to become health workers. After 3 years of service, the most talented and committed of the trainees compete for scholarship offered by Amurt to enter the School of Health to become qualified health workers. Local health workers make it easy to create a relationship with the communities and mothers in the villages. Many health workers in Amurt assisted health centers not only knows the name and face of each pregnant mother in her area, she also knows where she lives. The health workers go for home visits to pregnant women and postnatal follow-up visits. Each village in the project areas has a maternal health promoter elected by the women and trained by Amurt. The maternal health promoter identifies and monitors all the pregnancies in her village. She guides and encourages them on how to take care of themselves, attend antenatal, and give birth at the health center. They monitor home births, enabling us to know the reach and impact of the program. Together with health workers from the clinic, the maternal health promoters conduct monthly support group meetings for all the pregnant women. They are grassroots mobilizers and educators for family planning and other village health education campaign. The communities organize health rallies that brings health education together with cultural displays. in an uplifting and colorful setting. In the Amurt Assisted Health Centers, antenatal care days are weekly or bi-weekly. Doctors are present to examine and counsel the pregnant mothers. Ultrasound scanning is available free of charge. A well-equipped laboratory carries out investigations such as HIV, malaria, urinalysis, hepatitis, hemoglobin, etc. Through examination and obstetric history, the pregnant women at high risk for complications are identified, counseled, and recorded for follow-up through home visits. Amurt goes to a great length to ensure that all necessary precautions are taken to enable all mothers give birth safely. Amurt manages a custom-designed electronic database of all pregnant women in our project areas for easy monitoring of high-risk cases. While most deliveries proceed normally, in around 15% of all births phase, there are complications. The birth attendants must be skilled and equipped to respond to complications before they become serious. In the birth room, we keep the various drugs and equipment necessary for basic emergency, obstetric, and newborn care. Uteronics to control postpartum hemorrhage, magnesium sulfate for preeclampsia, light and suturing materials for tears, anti-shock garments, manual vacuum aspirators, masks and bag for newborn with breathing difficulties, oxygen, etc. Women from within the Amurt project areas benefit from free delivery on the condition of regular attendance of antenatal care and support group meetings. Other women pay only 2,000 naira, about $5. Amurt has deployed ambulances in the rural clinics with full-time standby drivers who, in the event of an emergency, can rush the patient to hospitals for life-saving interventions such as cesarean section. For the rural dwellers without means, Amurt provides assistance so that no lives are lost due to lack of finance. In special cases, Amurt also assists families to pay for life-saving surgeries for children. Each Amurt Assisted Health Centers has male, female, pediatric, and postnatal wards. With regular doctor visits, all the health centers are well prepared to receive patients on admission. In addition to maternal and newborn care, the health centers are open 24 hours for general outpatient services. They also offer family planning counseling, immunization services, HIV care, and minor surgery. Amurt Wash program gives rural communities access to safe water through the provision of boreholes. To reduce the transmission of communicable diseases, Amurt trains washcoms, which means water, sanitation, and hygiene committees in each village to protect water sources, maintain the borehole, and promote sanitation and hygiene. Amurt has prioritized villages affected by recent cholera outbreaks in 2015. Since 2011, we have over 80 boreholes in 4 different local governments. Through the health centers, Amurt encounters women who are the sole breadwinners for their families. Most of them are widows and they struggle to provide for their children. In the Economic Empowerment Program, women are brought together in a cooperative setting to manage a revolving credit fund that makes available interest-free loans to members who want to start a new business. Amurt provides basic training in business planning and bookkeeping. The program enables the women to become financially self-reliant. So far, 4 such cooperative groups reaching over 80 indigent women. To provide the health care services and support for the health activities in the villages, Amurt employs 5 doctors, 4 midwives, 2 lab scientists, 1 family planning counselor, 2 M&E staff, 1 construction supervisor, 1 community relation program officer, and water sanitation and hygiene manager, and 6 full-time drivers. The Amurt staff are always ready to go the extra mile for the patients and the welfare of the communities. They make daily visits to the health centers for medical services, training, health education, monitoring, and mobilization. Amurt aims at strengthening the partnership with Ebonyi State government and the communities in order to extend the program to more remote rural areas in the state. The program aims to reduce maternal and newborn mortality through a primary health care delivery model where the community plays a central and active role.